Good afternoon. I'm Talema and I had helping healthcare workers avoid burnouts. What is a burnout? Anyone who has worked in healthcare has likely seen at least one professional burnout, and these are some common three burnouts. So the first one is emotional exhaustion. When you are feeling emotionally worn out and drained as a result of accumulated stress. Depersonalization. A professional will develop negative or an attitude towards their patient or work. Reduced personal accomplishment. Professionals experience burnouts begin to feel like they are not making a difference in the role. This leads to like negative feedbacks. So basically, you will feel that you are not giving your best performance in your job role. Signs of a burnout: chronic fatigue, forgetfulness, isolation, and poor performance. And this is a chart that I feel like tied with the whole presentation, and I thought it was pretty cool. So I'm gonna read two from each. Physical signs and symptoms of burnout: feeling tired or drained most of the time, changing in appetite or sleep. Emotional signs of symptoms of burnout: sense of failure and sense of doubt, loss of motivation. Behavioral signs and symptoms of burnouts: withdrawal from responsibilities, and using food, drugs, or alcohol to cope. The main idea I felt was, how can we stop everyone in healthcare stop having so many burnouts? So these are some statistics that I have found. In the hospital, 43 have symptoms of emotional exhaustion in 2001, and 2011 studies reported burnout prevalence 37% in nursing homes and 33 among hospital nurses. What is the cause of this action? So basically the big point is emotional exhaustion, because you're pushing your body to emotional exhaustion. So it's a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. It occurs when you feel overwhelmed, emotionally drained, and unable to meet constant demands. Who is impacted? The first person who's impacted is your patient. You can be a negative impact on the patient and perform patient care. And it was a study in 2018. A study was shown that patients perceive how low satisfaction with care. Your body burnouts can also cause long-term changes in your body that makes you vulnerable to illnesses like the flu or even a cold. Relationships: being in a negative mindset can lead to constant taking your frustrations on others, like your partner, your family members, close friends, or even your brain. Neurologists discovered burnouts that has affected on brain, particularly enlarges your amygdala, which is part of the brain that controls your emotions, so it can cause you to be more moody. How might our society and environment and healthcare system be affected? If you are burnt out, you are not in the right mindset. You are not going to give the best care or the best performance, no matter the job, no matter if it is healthcare or any other job. What does this mean for nurses or other professionals in the healthcare field? Basically, so the whole goal is to try not to burn out, so you can give your effective performance no matter the job, whatever it is, nurse, physician, anything. How to prevent burnouts. So I've seen this 5 tips. So it was: take breaks, encourage healthy habits, take a vacation, get more exercise, and learn how to manage stress. And this is my reference page.